Let's be honest. Figuring out what kind of doctor you should see can feel like decoding a foreign language. Today, I'm breaking it all down for you and showing you why naturopathic doctors are the best option for disease prevention, and naturopathic doctors aren't the only doctors that you might need in your life, but if you care about prevention and longevity, a naturopathic doctor just might be exactly what you're missing on your care team. I'm Dr. Haley. I'm a naturopathic doctor, and I help men and women just like you rebalance their health, reclaim their vitality, and come back to themselves naturally while preventing disease and addressing the root cause of their current symptoms, not just suppressing them. Let's get into it. Naturopathic doctors don't just wait for disease to show up. We don't just slap a diagnosis on someone because their symptoms fit a criteria. We specialize in preventing disease, restoring function, and helping your body heal naturally. NDs go to a 4-year accredited medical school after their bachelor's degree. We study everything from anatomy to physiology to biochemistry, clinical nutrition, botanical medicine, homeopathy, physical medicine, mind-body approaches, counseling, and so much more. We kind of cover everything. Yes, we study pharmaceuticals and diagnostics, just like your conventional medical doctors, but unlike them, we're trained to ask why you're sick in the first place, to figure out what's really causing an obstacle for you to see healing. And we treat the root, not the symptoms. I know the term root cause can feel kind of buzzwordy right now, like it's a very trendy thing to say, but naturopathic doctors are the ones who have been doing it the longest, and we know what we're talking about because we do study the human body and the natural healing systems of the earth. We don't just rush through 10-minute appointments. We take our time. Most naturopaths will spend 60 to 90 minutes with you in your initial appointment to understand your full health story, your diet, your lifestyle, your environment, your emotional health, because it all matters. All of this contributes to who you are as a person, not just your symptoms. Naturopathic medicine is for the people who are ready to stop outsourcing their health and start reclaiming it. If that sounds like you, naturopathic medicine is definitely for you. Now let's talk about MDs. These are your medical doctors, the most recognized and most reimbursed by the insurance companies, and most overbooked type of doctor in the US. These are typically your primary care doctors, your surgeons, your specialists. They are primarily trained in drugs, surgeries, and procedures. That's the model. It's powerful in emergencies and acute conditions, but when it comes to prevention, lifestyle, or chronic disease, the system is not built for that. Their education is heavily focused on pathology, pharmacology, and protocols, not nutrition, not root cause healing, and definitely not why you're sick. Most MDs want to help, but they're in a system that rewards quick fixes and symptom suppression over long-term wellness. Chiropractors are the doctors of the spine and the skeleton. If your back hurts, if your neck's out of alignment, they're the people you typically go to. They're trained in musculoskeletal function and spinal adjustments. Many are passionate about natural health, which is amazing, but their scope focuses on the physical structure and not full body internal medicine. Some chiropractors do take additional training in nutrition and functional medicine, but that's not the standard in chiropractic school, so not all chiropractors are alike. Osteopathic doctors, or as you might hear them called DOs, are very similar to MDs, but with a slight holistic twist. They go through the same rigorous training, the same licensing exams, and the same hospital residencies, but they also learn osteopathic manipulation, a hands-on technique for assessing and treating the body. So this might look from your perspective like chiropractic, but naturopaths, chiropractors, and DOs all have this hands-on modality skill that they share. They just approach it from different lenses. Some DOs embody a more whole human approach, but many practice like MDs, prescribing medications and following the same standard of care protocols. Nurse practitioners are highly trained nurses who can diagnose, treat, and prescribe. They often spend more time with patients than your conventional MDs, and their approach can feel a little more human. Most NPs have master's degrees or a doctorate in nursing and work in both primary and specialized care settings. But here's the thing, they're still working within the conventional model, which means the emphasis is still on managing symptoms, not on preventing or reversing disease. Some NPs are amazing integrative providers, but that's often more of a choice in continuing education, not by default. Here's the kicker. A lot of what determines who you see depends on what your insurance covers, not what's actually best for your body, your mind, or you as a whole human. MDs and DOs are licensed in all 50 states and fully covered by insurance because they follow the standard protocols within the conventional medical system. NPs are covered in most places too, though their scope of practice varies. Chiropractors have limited insurance coverage, but usually only for spinal care, so like those adjustments you might go get. And then NDs, we're licensed in about half of the states, and growing, always. More states are becoming licensed every year, but insurance coverage is still spotty. And because the system isn't set up for prevention, it's set up for disease management, we get paid less automatically. For spending more time with our patients and actually reversing their conditions, we get paid less through the insurance model. So, personally, I don't opt into the insurance model, but a lot of naturopaths do. So, you can find one that can work with your insurance in most states, but generally that varies a lot more, and naturopathic medicine tends to fall in an out-of-pocket cost as compared to the other practitioners. But here's the truth. If you want a quick fix, take a pill. It's not actually going to fix the problem, but it's going to suppress the symptom you're experiencing. If you want structural help, see a chiropractor, an osteopathic doctor, or a naturopathic doctor. And if you want trauma surgery or have an emergency, go to the emergency room. But if you want a partner in health and longevity and vitality, a guide on your healing journey, a real shot at preventing disease long term, then a naturopathic doctor is the best investment for your health you'll ever make. So now you know the general differences, and hopefully you feel empowered to make choices for your health on your healing journey. If you're done outsourcing your health to a broken system and want to take your health back into your hands, naturopathic medicine is here for you. I'm Dr. Haley, and this is the future and the ancient past of medicine and healing. We've always been here, and we'll be here for you. Hit subscribe, share this video with someone who needs to hear it, and let's change the way we do healthcare together, one empowered choice at a time. We can all exist and help each other through this world, and healing starts with you.